We are talking about CBD in these cases. I will say this, THC actually does seem to have some potential to aggravate seizures or worsen seizures in cases. Now, there are other cases where THC in a very small amount, maybe more of that 1-to-1 ratio, may be beneficial, but more often than not, no, we're focused on the full spectrum CBD, not the isolate, just a full spectrum CBD, just like we're talking about in your products. Very similar to what we're seeing with some of the now approved pharmaceuticals on the market. So I'll walk you through some of these studies, and they're really fascinating. I'm just going to go through the bullet points. We have 6 of them, but you'll see a similar pattern. Study number 1, and for those listening, this will be posted in a blog post where they can go reference this. Study number 1, 19 children were gathered. They had this idiopathic or incurable epilepsy. CBD was found effective in 16 of the 19 children. 14 of the parents saw significant seizure reduction. They also reported improvement in mood, sleep, alertness, all the other great benefits we hear from CBD. And this coincided with a study that was done across many epilepsy treatment centers worldwide. They reported finding similar results, that up to 45.1% of a reduction in seizure symptoms in children. And we'll go into that study in a little bit. Another study that I think is obviously based on phase 3 clinical trials, now Epidiolex, which is now the approved pharmaceutical CBD product, right? They also saw a seizure decrease on average of 54%, okay? Mimicking some of these other non-clinical trial studies. We keep seeing that number over and over again. And when something is reported as incurable, getting a 54% improvement, I think is absolutely remarkable. Now, it should be noted in the case of the medication, 7% of individuals reported a worsening of symptoms. Interesting. Remember, pharmaceutical is different than what we're talking about. From my experience and just talking to individuals, a lot of them, the medication is very expensive, and it would appear that if you're getting a high quality CBD product like offered at CBD BioCare, you may be able to reap the same benefits for a fraction of the cost. And I don't hear those side effects all that often. Let's go through this one. This is a study taken out of CBD, A Patient's Guide to Medicinal Cannabis. 2015, an open label study, 162 pediatric epileptic patients. They were given CBD at a rate of 4 to 10 milligrams per pound per day. And they titrated all the way up to 50 milligrams per pound per day. This dosage reduced seizures, they claimed, at a rate similar to other prescription medications on the market, but mind you, without the side effects, okay? 4% of the patients became seizure-free. That's unbelievable, living a life of seizures and having the possibility of even a thought that one could become seizure-free. Again, a 2016 study, this was a big one, 201 children suffering from epilepsy. A Dr. Goldstein gave them dosed CBD oils. 68% of the children had greater than 50% improvement, with 15% of those children reporting becoming seizure-free. Over 40% of the children in that study were able to reduce pharmaceutical therapies. I believe the average pharmaceutical therapies tried for incurable epilepsy is around the number of 12. Imagine that many pharmaceuticals going into that young person. It's a tough situation. I'm not saying it's wrong. I'm not saying I'm right. I'm just saying that is a tough situation. Now, the only reported side effects, drowsiness in that study. And the last one, a 2016 study done in Israel, because Israel doesn't have the regulations that we have. That's why you're seeing so much research coming out of Israel. 74 pediatric patients, 89% reported a reduction in seizure load with CBD therapy, with only 5 of those reporting a worsening of seizures. We'll talk about those potential side effects when we go into serving size, because I'm going to talk to you guys a little bit about serving size and how to utilize that. The recommendation is 0.5 milligrams per pound per day. Okay, so let me break this down, broken up into 3 separate servings throughout the day. So if we have a 50-pound individual, you could divide 50 by 2. That gives you 25 milligrams. So you would be giving a dosage of 8.3 milligrams 3 times a day to give you a total of 25. So a 50-pound child, divide 50 by 2. That gives you 25. Divide 25 by 3. And that gives you the serving size dose 3 times per day. There's another way you could get there too. You could also do 0.5 times 50, wind up with 25, obviously, and then you're getting the same equation. So that is the pretty accepted way of dosing it right now when it comes to pediatrics. I want to say that Dr. Goldstein said, I did have it written down. I want to say, I think she found that most people responded to between 20 and 50 milligrams of CBD a day. Let's see. Oh, no. She found that they respond between 2 and 8 milligrams of CBD per pound of body weight a day. So that could be a decently high amount for some individuals. 2 to 8 milligrams per pound per day, split up 3 times a day. But stick to that equation, and that's a safe starting point. And I want to say this. You definitely want to go slow because CBD is biphasic in the case of seizures, especially if there's a bunch of other seizure medication involved. You want to go slow and work your way up to that point of effectiveness. Don't start high and risk flipping the switch on things. When it comes to seizures, I mention this all the time. Seizures, cancers, bipolar disorders, I encourage people, you at the very least just get permission from your physician. They might not know what they're doing. They might shrug their shoulders and say, sure, that's all you need. Because then you got an eye on it. That's it. Because seizures are tricky. Most neurologists are completely on board with this. I have yet to run into one that's not.